you'll notice the first thing at the very top is what you do first, the vertical gauge. For each millimeter step, a vertical measurement with a corresponding horizontal key. These keys, if you look across the top, the number at the very top is the vertical set. The next numbers going edge to edge or end to end, 1, 2, 3, and then drops down to 4, 5, 6, and 7. What would happen if she was to open and it was to fall in? That's where our safety guard system comes into play. We can put it here like this, which is a good place to put it. And then if she was to open for me, see, it would either fall that way or it would fall like that, and it wouldn't fall down her throat, okay? Okay, grin for me. We're just going to be taking and measuring the distance from either the lingual side of number 8 or 9 versus 24 and 25. And when we look at that, we see that that is probably about 1 or 2 millimeters, okay? All right, that's a good number to know. Now, the next number I want to know is what is the distance, and Don, if you open up for me, kind of protrude your jaw out a little bit. I want to know the difference between the lingual side of the tooth of 24 and 25 to the facial of 8 and 9. Okay, so Don, if you'll just kind of protrude your mandible out right there, and then I just measure that. Okay, in this case here, we're looking at probably about a 5. Okay, all right, that's a 5. Yep, could be a 4 or 1. That's more like about a 4 or 5. Okay, that's good. If the patient has a max protrusion measurement of 4 millimeters or less, the vertical measurement with the vertical gauge is a critical measurement. What does that mean? That means that we have to get it right. We have to get that sound, okay? Now, in Donna's case, she's almost a 5. So if a patient is 5 millimeters or greater, vertical is not that critical. If you have a little bit of a snore noise at the end or air turbulence, that's okay. Because Donna, if she had been a 5 millimeters or greater, like a 6 or 7, that means that we have a lot more horizontal adjustment, and we can adjust that out in the horizontal. All right, when we begin optimal air, we have our patient in the chair. And what we want to do is we want to kind of talk to our patient a little bit. Notice that the chair is in an upright position. And we just want to kind of have a little bit of an interview with our patient. So now tell me, can you possibly make a snore noise for me? Now, a lot of people make snore noises when they're asleep, they're unconscious, but some people can do it. And I'm just wondering if you could just maybe crack open your mouth just a little bit and see if you can make a snore noise. Okay. Now that's about a 3. Could you give me maybe a 10? That's good. Okay. Now let me ask you a question. Is that coming from here, or is it coming from your throat, your lower airway, or is it coming from your upper airway in your nose?
Lower airway.
You think so?
I think
All
so.
right. Okay. Well, let's check that. Okay. We always want to check to make sure that the patient understands that. This is patient education, and it's going to help you in this process. So what I do is I tell the patient I'm going to pinch their nose off, and I ask them to make that same snore noise. Okay. Big difference, right?
Yes.
That's right. So now we see that there's a difference, and the patient understands that. And now I'm asking her to focus on her lower airway. Okay. Okay. Now with the nose, snore again. Big difference. Now, you say we don't treat the nasal passage. That's true. But what we're going to do is we have to take that into that factor into the equation, because we need to make sure that this patient is breathing. So what we're going to do now is we explain to the patient we're going to lay them back, and that we're going to use a nasal dilator to open up her nasal passage to help her breathe better, so that we can focus on getting a patent and a clear airway. Okay, so we have our patient laid back in the supine position. Now, something that's really important is that the patient needs to be flat. They don't need to be like they're falling out of a chair or the head up, okay? And you might want to back up away from the chair to get a good view of that. That's very important that we have the patient's head where it's not like this or this, but it is flat level, a flat level with the floor. Now, let me say this about snoring. Sometimes when people snore in their sleep, they don't pull so much from here as they do from the lower airway, but this still can be a factor we need to eliminate. This is the nasal dilator. Many other dilators on the market that you can use. We're going to fit it. It actually goes in like this, but we fit it to the patient's nose by putting it on the outside of their nose and on the bridge, and we see that that's right. This can be adjusted in or it can be adjusted out. Once we have it, we pinch it, we come straight in, and then when we get there, we just kind of let it come out. And then what that does is it pulls out. Sometimes we might have to give it a little bit of adjustment. It pulls out and helps Donna to be able to breathe, our patient to breathe better. Okay, Donna, big deep breath in through your nose, and then out. So now we've got that taken care of. Now we're going to focus on the lower airway. We're going to bring in our vertical gauge, and our vertical gauge, remember, goes from 4 millimeters all the way up to 10. Good thing is on both sides, okay? It identifies itself as the vertical gauge on the end in the kit. All right, so what we're going to do is we're going to ask Donna to open up. And when she opens up, again, we may have teeth that are uneven, 24 and 25 or 8 and 9. Pick the ones that are the most level. You can be in the middle or you can be on one tooth. In the middle, splitting the midline is the best way. If Donna open up for us, I want you to notice that we always go maxillary 8 and 9 first, that we slide up to that little step right there. And then I get her to protrude out her mandible or her jaw and then slide it down, and you see it falls right in the notch. Now, here's one thing I want to bring your attention here is that you see how it's pulling back, okay? We don't want that. We want it to be straight, vertical. We're going to start with 4 millimeters. People may say, why 4 millimeters? 4 millimeters because that is the standard vertical that most all labs ask for to make an oral sleep appliance. That's our beginning, okay? All right, so we're going to come in. We always do maxillary first. We go 4, and we'll go right up at 4. She puts her teeth right in the notch. Go ahead and bite right in that notch. We get right there, and we ask Donna to make a snore noise. Okay, again. Okay, thank you. Open up. So what we're listening for is we're listening for for that airway to become patent. Okay. Now what we're going to do is we're going to open up vertically 5 millimeters. So I go up to the next notch right there. Donna finds that little notch. There you go. All right. We see everything is level. Donna, give us that snore noise. Okay, wonderful. One more time. See how it starts to fade. So there's a difference. We can hear a difference that the snore noise or the vibration of any interference in her airway was less than it was at 4 millimeters. Now we're at 5 millimeters. Now we're going to go to 6 millimeters. Donna, if you will, close up on that. That's wonderful. Now notice this little bit of tilt back. I'm going to give it a little bit. Now, snore noise. Okay, there we go. One more time. Perfect. Now we open up. So we would say that her vertical set is 6 millimeters. Okay. Now we're going to open this up and we're going to say, let's go one step higher. So I switched around my rod and now I'm going to go 7 millimeters. I want to see, could there possibly be anything better than that? All right, Donna. Now you say, hey, it made it worse. Do it again. Okay. All right. Open up. That's the reason why our product is called Optimal Air, is because her optimal air setting is at 6 millimeters. Okay. Again. There you go. You can hear that you can hear it. So let's open up, Donna. Thank you so much. Swallow and relax. We're going to start with edge to edge. Edge to edge would be that E. 6 millimeters is the vertical space. The horizontal spacing is the next letter. Now we also have on this one a 4. That means that we could go to a 4 millimeter, but we want to go edge to edge. The whole time we were using the vertical gauge, we were bringing her like this. Green for me. Okay. Now bring your teeth edge to edge. Well, that's exactly what we were doing. We were taking that overjet that she has. Now go back in your normal bite, please. About a millimeter, about a millimeter. We were bringing that forward again, edge to edge. I can feel when she does that, boom. That's what we were doing. And I want to bring a note here, okay? The notch that's on the bottom never changes on any of the keys. It's only the maxillary. So mandibular never changes. It's maxillary that changes. That's why we use that. So we come in, Donna protrude your jaw out just a little bit and slides down and falls right in that notch. And there we go. We can see that's how it works. Okay. Now this is where I really find that the safety rod really comes in a little bit better. I use floss a lot of times with the vertical gauge, but I find that this works really good because if she was to open, it would catch the corners of her mouth. Okay, now I see that Donna's a little bit. I'm going to kind of straighten that up a little bit, kind of go with me. There you go. Now we're going to snore noise. Okay, one more time. Okay, we hear just a little bit at the end, but that's okay. All right. All right. Now what we're going to do is we're going to go 1 more millimeter. So I'm going to hold this one up right here. You can see we're going to go 1 millimeter. That's hard to see. That 1 millimeter, we're going to go a little bit more to see if there's a difference in that sound. Or is the airway still open and patent? So she comes in, she finds that little notch. And would you do that for me, please? Okay, that sounds really good, doesn't it? Okay, no tail end noise at all. Okay, totally open. Open for me. Swallow and relax. So we would say that Donna would be a 6 millimeter vertical and 1 millimeter horizontal. And that way, that's where we would start her appliance at. Now that we have found our vertical and our horizontal set bite, we're going to scan our patient upper and lower arch. You want to set your patient up at 45-degree angle. Take the same horizontal key that we found to be the correct measurement, place it between 8 and 9, 24 and 25, and then we're going to do our circular motion or straight from molar to canine so that we can get the alignment of the bite. This is our therapeutic bite set. Wouldn't recommend using the safety rod. It gets in the way of the scanning wand or handle, but to use a piece of floss if you feel necessary.